Le 20 octobre 2010, des militaires de la MINUSTAH sont déployés pour aider la population de l'Artibonite face à une épidémie de choléra. Une première épidémie depuis au moins 100 ans et déjà a fait plus d'une centaine de morts. Les casques bleus déployés dans les zones affectées travaillent d'arrache-pied pour sauver le maximum de vies possibles. What do you know about the cholera outbreak in Haiti?
Well, the MINUSTAH military learned about the cholera outbreak just as everyone else did, and it has been devastating to learn about the 200 people who lost their lives in Artibonite. My heart goes out to those people who lost their lives and to the families that are still living through this tragedy. When the MINUSTAH military learned that this outbreak started, we joined the World Health Organization and the Centers for Disease Control, as well as the Haitian Ministry of Health. We helped collect specimens from the people who passed away to determine the cause of illness.
So what is the MINUSTAH military doing right now?
Well, right now the MINUSTAH military is in Artibonite. We sent about 840 medical people from the Argentinian hospital. These are doctors and nurses, people who are trained in handling mass casualties. Cholera is spread by ingesting contaminated water, usually with fecal matter. So we've been working with other organizations like USAID as well as the World Health Organization to distribute thousands and thousands of bottles of fresh water.
Are the MINUSTAH's military's effort aggressive?
Yes, definitely. The MINUSTAH military has been very aggressive in trying to help the Haitian people since this outbreak. For example, every place we're trying to distribute fresh water is not reachable by land. The delta of the Artibonite River flooded Grand Saline, so we're using helicopters to distribute fresh water to the people in Grand Saline. And it makes sense to do that because we're here to help the Haitian people. We care about them, and we want to help them during this very critical time.
So what's the cure for cholera?
The main side effect of cholera is the rapid onset of diarrhea that literally dehydrates and depletes a person of essential electrolytes. You can die from cholera in just a matter of hours. So what people need to do is hydrate themselves with the clean water we're providing. I mentioned that when you suffer from cholera, you lose essential electrolytes from your body. If possible, the people should add a little bit of sugar and salt to the water and then drink it.
Are there any medication to help cure cholera?
Well, if you're able to get to the hospital and get treated, you are likely to receive one or two antibiotics. One is Cipro, the other one is doxycycline. And these medications will help speed the recovery. But right now, the hospitals are overwhelmed. On day 1, about 500 people became sick. On day 2, it went up to about 1,000 people who were sick. And on day 3, there were about 2,050 people who became sick. So when you get to the hospital, there's going to be a very extensive wait. So it would help tremendously if you start drinking lots of clean, fresh water before you even get to the hospital. A lot of people who are sick with cholera don't want to drink. They're going to feel very ill, but it's very important that they force themselves to drink this fresh water.
And what was the cause of cholera outbreak?
Well, the indications right now are that the Artibonite River was somehow contaminated, and that's why the majority of illnesses have been in St. Mark and in Grand Saline. So we can't necessarily tell people not to move around Artibonite, but we definitely can recommend that people not travel to Artibonite right now if they don't have to, and they should definitely try to stay away from the Artibonite River.
How can other Haitians prevent themselves from getting sick?
Education. Education is the best prevention. People should be washing their hands every day, several times a day, vigorously and with soap and water. It is so easy to pass on germs without knowing it. And you don't want to do that to your family, your friends, and your loved ones. There have been many, many deaths since this outbreak, and we don't want to experience any more death. We don't want to lose another Haitian life. Haitian life is very important, and the MINUSTAH military intends to help save the lives of these very important Haitian lives.
Are there any symptoms or signs?
That's a great question because a lot of people think that if they just don't drink anything but bottled water or if they don't eat off the street, then they are free from contracting cholera. But the fact is that you can contract it by touching someone else who is infected who didn't wash their hands. So you really need to do proper hand washing frequently and vigorously. People who are infected with cholera are not even symptomatic for the first 5 days, so that's something to keep in mind.
How many people have MINUSTAH's military treated so far?
Well, in the Artibonite area, there are about 3,000 people who are affected. And since the treatment is clean, fresh water, we've essentially been treating about 3,000 people. And we are hoping that those 3,000 people recover successfully.
Is there anything else you would like to say to the Haitian people during this?
Yes, this is a very, very sad time, and the MINUSTAH military is grieving the loss of these Haitian lives because we are seeing the suffering firsthand. The MINUSTAH military is committed to helping the people of Haiti. Our mandate is to provide a safe, stable, and secure environment, and that includes protecting the health of the local population. We have aggressively deployed to the Artibonite region to help control the situation, and we intend to stay there helping until this critical phase is passed.
Thank you very much.
Thank you for having me.